Welcome to the Hawaii Health Data Warehouse's Coffee Break monthly webinar series. I'm Julia Chosey, a public health epidemiologist with the Hawaii Health Data Warehouse, or HHDW. Today, we are going to be discussing maps and geographies. Maps are important because they can help people visualize data and see geographic patterns. For example, epidemiologists can use maps to track the spread of disease, ecologists can use maps to understand wildlife movement, and climate scientists can use maps to understand changes in weather patterns. First, we're going to look at hawaiihealthmatters.org, or HHM. Most of the time, when you click on an indicator in HHM, it opens a page showing the state level data. So in this case, there's no map that shows because it wouldn't really help with the interpretation. But once you scroll down past the data, you'll find a box with tabs, one for each of the geographies the indicator is available for. Choose one of these to see a map, chart, and data table for that geography. The geographies that are available depend on the data source of the indicator. We try to provide the data at the most granular level possible, but not every data source is designed to be able to make estimates at small geographies. However, with some of the indicators on Hawaii Health Matters, you can get data all the way down to the census tract level. You can tell which geographies are available for an indicator by looking at the tabs of the geography selector box. So for example, this indicator has data at the state, county, primary care service area, census place, zip code, and census tract levels. One helpful resource we'll look at on the HHM is located in the community health dashboard. On the right side next to the Find a Location drop-down menu is a pin highlighted here by the red arrow. And if you click on it, it will open up a map that lets you see the geographic definitions of all the different geographies on HHM, which include state, county, primary care service area, census place, zip code, and census tract. Before we jump over to the demo, I also wanted to mention the Socio Needs Index on Hawaii Health Matters. Here you'll find detailed maps that rank health equity, mental health, and food insecurity for the state. The maps are available at the county, zip code, and census tract level. For more information about the Socio Needs Index, please take a look at our YouTube channel for the coffee break that we did on this tool. Let's move into Hawaii Health Matters. So here's our homepage, again with our rotating banner, and check in later to register for the October coffee break. And the first thing I wanted to show you was that resource that I mentioned. So you can find that by going to Find Data. You can go directly to the community dashboard here, or if you click on Find Data, it will open up a landing page where you can also get to the community dashboard. So here you'll see this Find a Location, and this is where you can select a geography. So again, if you're interested, this is a great place to search for indicators. And if you were interested in a particular geography, you could go ahead and narrow it down to that. But this little pen here opens up this nice map, and this gives us the definitions of the different geographic areas. So for example, here are the primary care service areas. And if you were wondering what a particular primary care service area is called, you can hover over it and on the map, and it will give you the name. So this also shows you the data for census place, for zip code, and for census tract. So this is a nice resource to have available if you're working with HHM data at smaller geographies and you need to know the definitions of those geographies. But let's take a look at an indicator. I'm going to go ahead and go to the Healthy People 2030 Progress Tracker because I feel like this is a really good comprehensive tracker. If you're interested in learning more about this tracker, there's information here. And there's also, we've done a coffee break on this tracker too, which you can access from right here. For us today, I am going to scroll down to kidney disease, and we're going to look at adults with kidney disease. So when we click on this is going to give us the state level data. So you'll notice there is no map, but that's just because we need to pick a different geography, a smaller geography to see the data. But real quickly, for those of you who have less experience with Hawaii Health Matters, we've got for each indicator, the definition of the indicator and a little bit of public health importance. And then we have our data. So we can see the point estimate for 2022, and this is from the Behavioral Risk Factor Surveillance System. You can see some comparison data that help you really put that 3.4% into perspective. We have the trend data and then the breakout data. In this case, we have lots of different groups that you can see the data by. But if you scroll down below the data, this is where you'll see the geography selection box. So for this indicator, we can see that the data are available at the state, county, primary care service area, census place, zip code, and census tract level. So it's actually all of the different levels that are available. Let's take a look at county first, just to get an idea of what the map looks like. So what this does is it ranks the 4 different counties and it displays them on the map with the highest prevalence being the darkest blue. You can, however, look at the data by Hawaii state values. So, for example, this will show you that Honolulu County is the only county that is lower than the state value. The other three counties are higher. We can look at the median value for states and territories, which looks very similar. So there's other ways that you can look at this map using different comparison values. There's also some manipulation that you can do with the map. So you can zoom in and zoom out, of course. You can also expand the map so that it's easy to see. You can export this map as a JPEG. You can also add labels. So these will label the different counties. You can turn this background so it can be either gray, white, or blue. And then there's a transparency option. And this will let you then go ahead and put the map back to a smaller viewpoint like that. As you hover over one item in one of these boxes, whether it be on the map or the chart or the data table, it highlights the corresponding item. And this is really helpful when you're looking at, let's go ahead and look at this by the zip code level. And now we're going to have a lot of geographies. This is where that really comes in useful, where you can see where the different zip codes are. But now we have our map by zip code. Again, it has ranked the values into quintiles. So we'll see the zip codes with the highest prevalence of adults with kidney disease are the darkest blue. And again, you can export this map as a JPEG very easily. If you wanted to only see one particular county, you could filter here. So for example, if we wanted to only see Maui County, now what we're seeing are all the zip codes just for Maui County. So this gives you a little more detail if that's the geography of interest. And then again, the data table. And of course, our related content that comes with Hawaii Health Matters. So this is all going to be resources revolving around adults with kidney disease. Now let's discuss hhdw.org. And for those of you who are unfamiliar with it, it houses data from these 5 data sources: the Behavioral Risk Factor Surveillance System, the Pregnancy Risk Assessment Monitoring System, the Youth Risk Behavior Survey, the Youth Tobacco Survey, and our Vital and Statistics. And the reason I'm letting you know that is because the mapping function is a little different depending on the data source. With PRANS and YRBS, for both of these data sources, estimates are only available at the state and county level. So you'll actually select your geography of interest when you choose the indicator, as you can see here. If you choose the county option, a map will automatically appear with your query results. Versus and vital statistics are a little bit more complicated because they offer geography at a lot of different levels, more levels than just the state and the county. So usually when you're looking at your default query for these data sources will not show a map because again, it's going to be at the state level data. So you need to modify the query to select your geography of interest. This is part of the last step in the query builder page using the display by options, and we will look at that in a few minutes. Now, BRFIS is a large survey, and as such, we're able to make estimates at some fairly granular geographic levels. So on HHDW, BRFIS data are available at the state, county, island, community, primary care service area, and school complex levels. The geographies available for our birth and death data depend on whether the results are counts or percentages versus rates. So you can see here for births that counts and percentages, we can offer the data by infant birth location to the island level and by mother's residence to the school complex level. For rates, we only have the mother's residence at the state and county level. And this is because rates require denominators taken from population data. For example, if you want to know the birth rate per 1,000 females on Maui, you have to know how many females there are on Maui. So these population estimates are not hard to come by at the state and county level, but they get more complicated at smaller geographies. So our rates are available at the state and county level. And you'll see a similar pattern for our death data. For the count data, we can offer the location the death occurred to the island level, and we can examine the decedent's residence down to the school complex level. But for our rates, we only offer death rates for the decedent's residence at the state and county level. Now, last we have YTS, the Youth Tobacco Survey, and it's actually not designed to make estimates at any other geographic level besides state. You'll see this is your only option when you're looking at indicators from YTS. And because of this, YTS actually doesn't have any map. Before we move on to the demo, let me just give you a little more information about some of the geographies offered in hhdw.org. In addition to state, county, and island, we have a community geography, which consists of 24 units. This was created by a working group in 2000, and it's based on aggregates of school complexes. so that there would be enough BRFIS respondents to report data at that level. Then we also have the primary care service area, which consists of 35 units. These geographic units are based on census tracts and selected to represent geographic approximations of markets for primary care service area. So this means that each PCSA represents the geographic region from which a healthcare provider like a hospital or a clinic draws most of its patients. And then lastly, we have the school complex level, which consists of 39 units. And each of these units includes a high school and the elementary and middle or intermediate schools that feed into it. All right, let's take a look at HHDW. So again, here's our homepage. Again, you can sign up for the coffee break here. You can see what our featured content is for the month. But we are going to look at a couple of the data sources so that you can see an example of how to look at the map. So let's start with YRBS, because we know PRAMS and YRBS are both state and county estimates, so they're a little bit easier. Here we are on the Youth Risk Behavior homepage, and again, for those of you who aren't as familiar with HHDW, this is a great place to find resources about YRBS. So you have the actual surveys and documentation. What we're going to do is build a custom YRBS report. So what we're seeing here is the indicator selection page. This is where all of the indicators are available for browsing. So let's just look at high school. For the YRBS actually asked two different similar but slightly different surveys of high school and middle schoolers. So we're going to just look at the high schoolers for now, and you can see the different categories of health indicators that are available. So we'll just look at, say, general health, we'll look at health status, and let's look at preventive services or doctor checkup within the past 12 months. If you wanted to know the exact question that was asked, you can hover over this question mark right here. So you'll see immediately we only have selections for state or county level data. If we were to choose the state level data, we would not get a map, but we'll choose the county level so we can see exactly what the map looks like. And this is our default query. This is our query result page. So this is going to show us exactly what we're looking at. So this is students who have seen a doctor or nurse for a checkup or physical exam when they were not sick or injured in the past 12 months, so a preventive visit. We're looking at it for the years 2017 to 2021, and we're looking at the data by county. So the first thing you can see is a chart, and you can hover over the bars and get the data values. You can also look at the data table. And one functionality that's nice in here is this sorting function. So now you can see exactly who's got the lowest and who's got the highest prevalence. But you can also do that by looking at the map. So just like HHM, this system ranks the different values for the 4 different categories, and it shows them in a scheme where the darkest color has the highest prevalence. So here we can see that Honolulu County has the highest prevalence, and if you hover over it, you can get the actual data values. Here you can also zoom in and zoom out. You can open the street map, which changes the background to blue, and I believe also puts some of the major freeways on there. You can't see them because the county is the full island, or you can keep it like this. You can label the counties or the islands, and unfortunately you can't export this map from here, but you can take a screenshot. So if this is something you want to share with a colleague or include in a report, you just have to take a screenshot. So that's what the county level data looks like from YRBS. Let's take a look at BRFIS. So we're just going to go to data sources and BRFIS. We're going to build a custom BRFIS report. And here we can see all of the different categories of health indicators that are available for this data source. So we'll look at chronic conditions and we'll look at high blood pressure. Now you'll have the option to use either a crude rate or an age-adjusted rate, and you can find out a little bit more about these options by hovering over the question marks here. Today we're just going to use the crude rate since we're not comparing to outside geographies. So here you'll see this is the default report, and it's at the state level. So we're seeing the 3 most recent years of data, and there's no map. But it's very easy to get a map. All you have to do is modify the query. And then when you click on this, it opens up this query builder page. And if you scroll all the way down to the bottom, it asks you, how do you want to display the data? So right now we're looking at it by year, but we could look at it by county, island, community, primary care service area. Let's look at it by school complex. And you'll notice when you pick a geography, you do get a few map options here in this step as well. So now we're looking at the data, by school complex level. And this is a great time to use that sort function again, so you can see which school complexes have the lowest and highest prevalence. The data table is here as well. And then below that, we have our map. So the system takes each of the different geographic units and ranks the values into 5 groups, with the darkest of which being the highest prevalence. So we can see pretty quickly those areas that have the highest prevalence of high blood pressure. So this is a great way to visualize the data and identify, especially if you're looking at a particular geography, you can show how that geography is doing relative to the rest of the state. Now let's give you a little time for some hands-on work. Take a few minutes to explore the maps and geographies on Hawaii Health Matters and HHDW and answer these questions. So the first question asks, what geographies are available for the indicator adults who are obese? So we would just go to Hawaii Health Matters. And in this case, I would just use the search bar up here, which is going to give us not only indicators, but also reports. But we should be able to find adults who are obese right here, the first indicator that comes up. So this is a situation where it's actually, instead of going straight to the state data, it gives you the geography. So we can see here that for this indicator, we can see the data actually at all the geographies down all the way to the census tract. The next question was about HHDW, and it asked true or false. PRAMS data it can be viewed at the primary care service area level. And that's false. So PRAMS and YRBS are available at the state and county level. And then the last question asked, which county had the highest prevalence of electronic bullying among high schoolers from 2017 to 2021? So we would again go back to our HHDW and we would go to YRBS because we're interested in data about high schoolers. We're going to build a custom service report. We're interested in high schoolers, and it asks about electronic bullying. So let's look under injury and violence. Sure enough, there's a bullying category. And here's our electronically bullied in the past 12 months indicator. So the question asks about the county. So we will select the county level data. And now what we can see is we can either look at the chart or look at the map, and we can see that Kauai actually has the highest percentage at 15.4%. Join us for our next coffee break webinar. On October 1st at 11 a.m., we'll be discussing the 2023 Youth Risk Behavior Survey data.